Bill Gradishar, professor of medicine at Northwestern University, where I am also chief of hematology oncology. There have been several patients in the recent past who I think fall into the category of what we would refer to as exceptional responders. One patient who I can think of very clearly, who just lost a long 20-year fight with breast cancer, was a lady who I started taking care of 20 years ago. And more than 15 years ago, she was diagnosed with metastatic disease. And this is a woman who, at the time of her development of metastatic disease or recurrent disease, she was being evaluated for some unrelated GI problem, some other complaint. And they had to do a small procedure that allowed them to visualize the contents of the abdomen through a laparoscope. And during that time, they took a couple of biopsies when they saw a few suspicious things on the surface of the lining of the abdomen, which turned out to be, in the end, a recurrence of her breast cancer, somewhat in an odd location in a patient who had probably symptoms that were somehow related to the presence of breast cancer, but they were clearly looking for another problem when they found this. So it was just sort of a fortuitous finding. And this was a hormone-sensitive lobular carcinoma, which are often characterized by, if they recur, not uncommonly going to what we refer to as serosal surfaces, funny areas, like the lining of the lung, or having drop metastases into the pelvis. And this is a lady who we treated for years once she developed metastatic disease with endocrine therapy, who did great. She continued to putter along. And only in the last, say, 5 years, so with 10 years of therapy for metastatic disease that really took the form of anti-hormone therapy alone, she lived a completely normal life, went to work, did all the normal things. And it was only in the last couple of years that we've had to resort to the use of chemotherapy. And even with that, she had several more years where she continued to do well, function at a high level. And only very recently did she demonstrate, clearly a decline in her functional status. And only really in the last year did she really manifest many of the things we see in patients with advanced disease. So this is a lady that I think is instructive and also inspiring, of course, because despite her diagnosis, she elected to live her life. And as a result, of that attitude, she enjoyed all those years. She wasn't waiting for the other shoe to drop, but rather going on about her business, raising her family, continuing to work right up to the end. And, from a clinician standpoint, we're always amazed not only at the strength of individuals like that, but also the behavior of the disease. As much as we know about breast cancer, as much as we think we understand about the molecular underpinnings of the disease, it's these cases that really make us understand that we really don't know all that much. Because although our therapies worked well and for a long time, we're not really sure what distinguishes the behavior of the disease in this lady compared to another lady with the exact same problem. So it's by studying these patients and hopefully having more of them as our therapies become more effective, we'll get a better grasp of the biology of the disease for all patients, including those that we refer to as exceptional responders.